Okay, so let me begin. I have my written up introduction. So my name is Art Oatner, proud member of the, hold on. Proud member of the Lyceum Committee. I'm gonna. Hold on. Yes. Did somebody say the Lyceum? Okay. Let me clear up a couple of things with the Lyceum. I'm having problem. Anyway, the Lyceum Committee decided that we would branch out and have Fraser specials. Where the Fraser.
I can't just say this.
Mute all these people for Christ's sake.
You're here.
Oh, I'm sorry. We have too much technology in our lives. Anyways, the Fraser specials will come under the umbrella of Lyceum. And
You're on it.
Art,
what is?
can you mute everybody?
I'm sorry. Let me shut my phone off and start again. I apologize. There we go. Okay. So I'm going to start over, and we're recording this. So if you don't want your name won't show up, but your picture will, you could always just take your picture out of the loop. And the Lyceum Committee is one of the more educational committees we have in Fraser. And we decided we would branch out to have a Fraser special, which this is, and they would be on Zoom if we can help it. And then we have live, the Lyceum Committee will meet live again if we can help it. So, for instance, if things don't get worse, next Tuesday, the 14th, at 7:30 in the Canyon Center, we're going to have a presentation, Boulder County District Attorney's Office, on scams and fraud in the senior community. Again, it's up in the air about if it's going to be in person. Now to the matter at hand. Tonight it is my honor for the 8th time to introduce Fraser's own Dr. Kurt Eshelman. Can you please yourself?
You want to do that, or you want to have
There's a cat. Oh, yeah.
Please mute yourselves.
Right. Sit
no
quiet.
talking? Yeah, or just doing all the time.
It's only at this point
Get
that
in?
See that black hair?
I'm going
Art,
to ask you
can you
to
mute
please
everybody?
There we go. Okay, anyways. Kurt Eshelman presenting the 8th in this series, catching up with COVID and its dreaded variances. Although we all hope and pray this might be the last one, let's get real, it ain't over. What can we do? For almost 2 years, Kurt has been the collator and author of emails about the coronavirus epidemic, drawing from the varied expertise of scores of collaborators, as well as the popular and scientific literature. He has produced almost 500 emails, and some of those have been correct. And a few he can learn the prescient. And now, in retrospect, these emails serve to document what was currently important as we fumbled our way through the worst pandemic in a century. And I might add, he makes it easy to understand. When Kurt starts, I'm going to spotlight him, which puts all of you on speaker view, and this event will be recorded for viewing on the Fraser channel. So listen, learn, get your questions ready, take it away.
Off that upper light.
I'm sorry, I'm going to interrupt here for just a moment. Nikki Heller, can you please mute your microphone? Art, you should have a capability to mute all.
I do, but during the introduction, it's a difficult thing. I got it. Now
Great.
I'm on top of it.
Thank you.
Okay, thanks again for coming. Your persistence and optimism cheers me. Welcome, especially to people from other parts of the country. So let me see if I can share screen. We had this right a minute ago, and there it is. Okay, so you should see me up in one corner, and you should see my slide. Give me a nod, the people I can see. Are you seeing my slide? Yeah, all right, good. Well, it's Rosh Hashanah, so Happy New Year, and our Jewish friends have something better to do tonight. So let's wish them well. I actually was thinking of getting a ram's horn and just blowing it tonight, and it might be just as informative. But that didn't work. How come? That finally did work. Okay. What I want to do first is to actually go back and review the whole pandemic. It's been going on now for 21 months, and I don't know why it strikes me as it's not a round number or anything, but it does seem to me like it was fun for me to review these things. But I think it may actually end up being more of a slog than it is a waltz. So I first want to do a review of the pandemic, and I'm going to draw from my Lyceum talks and show you slides, some of which I got right and a bunch of which I got wrong, but kind of emphasize the idea is to create that flavor of how far we've come, and then use that to set the stage to talk about the current status of the epidemic, touching on Boulder as well as the United States. And then, of course, we've got to talk about variants, and we got to talk about vaccines, and I will try to make predictions again. This is going to be my organizing slide for the first part, and this is the average daily cases for the United States. I'm only going to talk about the United States, my slide starts in March, where the epidemic actually started back in December in China, and it goes through the present. And these slides are from Johns Hopkins, and I tried to, any slide that's not from Johns Hopkins, I tried to label. So I broke our epidemic into 6 parts. There's the beginnings, and then a first, second, and third wave, and then we had a lull, and now we're in the 4th wave. So I'm going to look at this slide, and I'm going to, go back to the beginning. It actually is back before this starts. And you recall, it started in Wuhan, China. They started to report unusual cases of pneumonia and lots of people dying. The doctor initially who reported it wasn't listened to until he himself died and became kind of a folk hero in China, and people started paying attention to it. The World Health Organization saw that it was spreading outside of China, and declared a global health emergency at the end of January. 4 days later, the United States declared a public health emergency. And then you'll recall that the Diamond Princess cruise ship, remember that? These poor people couldn't get off, and 46 of them had it. They were in Japan for a while. And then the US citizens came back here, and we thought that's what the epidemic was going to be like. Well, of course, it quickly broke out of that. And we had a national emergency declared on 3/13. Fraser went into lockdown on the 15th. We moved in on March 2nd. March 15th, we were in lockdown. And then I wrote my first email on March 15th. And this was my first email. Didn't look like this, of course, but I was reporting on Colorado's 128 cases to date. That wasn't per day, that was total that Colorado had up to then. And this was the age breakdown. And we had 4 cases in Boulder County. That was my first email. The first one I only went to my kids. So that's the first wave. Now I'm going to start, or excuse me, that's the beginning. Now let's talk about the first wave, which in cases looks rather small. I'm going to show you, remember this was in New York and New Jersey and New England, and they had a terrible epidemic with lots and lots of people dying, but we didn't know how to test. The CDC didn't let anybody do anything but their own tests, and then the CDC's test didn't work out very well. And so it was a crazy small number of cases compared to what we really had. We'll see that a little later on another slide. But let's talk about that first wave. The first stay-at-home order was California on March 19th. Hydroxychloroquine was right out of the box. I mean, I don't know how anybody thought hydroxychloroquine was going to work and got going so quickly. And remdesivir was there on May 1st. So the remdesivir, of course, we still use. Hydroxychloroquine is long gone. Fauci started to become a household personality. And the first deal to produce vaccines was in May 21st. The peak of the first wave cases was at 30,000, and US deaths surpassed 100,000. Notice the mismatch. We were averaging 30,000 per day, which now sounds like a pretty low number. We'd love to have that number now, but we had 100,000 people die. And it just was because we weren't testing. We didn't know how it spread. Do you remember this? We were all, there was a nationwide run on disinfectants and alcohol wipes. And we were, Judy and I carried a Ziploc bag with a washcloth and denatured alcohol in it. We were wiping everything down all the time. We didn't do any good. And I started doing graphs. This was a favorite one. This was right at the end of March. And you notice how China led the world in the number of cases, but they weren't going up. And by the end of March, the United States had the most cases of any country in the world. Do you remember the other two big ones? You probably can't read. Spain and Italy. Remember how awful their epidemics were. Dr. Birx and Fauci projected the decline in COVID cases. And so Ed, my nephew, took a picture of the TV set. He's an engineer, and he reverse engineered the curve to imitate what they were predicting. And it proved way optimistic. We, of course, got nowhere near that low. Okay, so now on to the second wave, this bump. In cases, this was actually much smaller than the first wave, but we didn't record the first wave. So I got Ed to start doing graphs. And so for you, those of you who've been following the emails for a long time, I'm just showing this because he did the best graphs ever till he got tired and quit. My son, Toby, got COVID at work. That was a big event in the second wave. He did fine, as do most people. But the deaths do not go up as much as cases. And we realized how awful it was in nursing homes. And we quit sending hospitalized patients back to nursing homes. And that isolation in nursing homes improved the death rate a lot. It went from July to October of that year. Hydroxychloroquine was quickly found to not work. Fauci warned 100,000 per day, but it peaked at 70. But we surpassed a total of 3 million infections. And right the same day we passed 3 million infections, we withdrew from the World Health Organization. Astonishing fact. I mean, the worst epidemic in a century, and we withdrew from the World Health Organization. The first data came in on vaccines, that they were effective. This is July. It's interesting to note that the first report of it, that the vaccines worked, came out in July. We did a wonderful deal with a bunch. We threw big money at it, but we had some 9 contracts with companies to produce vaccines with the sense of some of these are going to work. And of course, we have end up licensing 3 of them. For the second wave, the cases peaked at 70,000 a day, and the total US deaths rose to about 250,000. The third wave is the biggest one. It went on for how many? 1, 2, 3, 4, went on for almost 5 months. It spanned the end of 2020 and into the beginning of 2021, and was really an awful epidemic in our country. Remember, Trump was hospitalized in October. He was a part of the third wave. By now, we knew that COVID spreads airborne, and most of us, or many of us, were stopping with all of the wiping things down. Another big event, that the vaccines were approved in December, and we started giving vaccines. The first variant was identified. It was identified in England, later called Alpha. I'm going to show you more about variants when we get to that part of the talk, but we had given 20 million vaccine doses by the end of 2020, but it was a huge surge with 250,000 cases per day, and the United States deaths topped 500,000 by the end of the third wave. In the third wave, I noticed something called the Belgian curve. This was the pattern of cases, daily cases for Belgium, and centered right around here around November 1st, this accelerating number of cases going up is an exponential rise, a mathematical term that just says it's going nuts and accelerating all the way up. It then peaked and suddenly dropped all the way down. And the symmetrical fall is unexplained. And it appears as though all of the susceptible people got it, and then the virus had nobody left to infect, but we know that's not true. And this was in November, before there were any vaccinations. The first debates of, so I'm gonna come back to that. You're gonna hear more about that, the Belgian curve. We got our Pfizer shots, that was fun. And the COVID tracking project gives us better statistics than the CDC. And we noticed that nursing home deaths went almost to zero after we vaccinated people in nursing homes in the first priority. I did 4 different talks during the third wave. So let me just show you some highlight slides from those talks. These were, we talked about the different vaccines. AstraZeneca was in England, didn't come here. Remember this slide of the Pfizer effectiveness, and we blew up this. There's so few cases. We really looked like the first shot did everything, that you didn't need to have a second shot. That's since proved in error. Remember this slide, Colorado got 1.69% of the US supply of vaccines. And remember the graphic in the winter with this little snowflake up there? These were the highest priorities. And if we got these accomplished, we went on to these. So we started with nursing home and long-term care facility staff and healthcare workers, and quickly went to us. I started doing, Johnny Carson and I started doing predictions, which make me at least focus on what's really going on. They prove in error, but it is a cause for focus. Anyway, the January predictions I got really right. So here, when I looked at these the next time, I nailed it. Peak at 250,000, deaths at 300,000 per day, and the lockdowns will continue as vaccine rollouts are disappointing. All of that happened. Want to have you recall that at its worst during the third wave, COVID was the leading cause of death in the country. COVID makes, at that time, the daily deaths from COVID roughly equaled the combined total of people dying from heart disease and cancer. That was terrible. It's terrible. For the whole year, it ended up being the third leading cause of death. But at its peak during the third wave, it was the leading cause of death. And we had our vaccine clinics, got our first and second shots done by the third week in February. And then from Binkley should have his anxiety closet closed now that he's had his vaccine, but the anxiety wasn't over for Binkley, and it isn't over for us. Remember the Swiss cheese model? Remember I actually made those wooden things and olives and chopsticks going through, but the idea was to protect the person from the coronavirus. You put lots of layers, some of masks and distance, and finally vaccines. Again, we talked about variants, and the variants had added to. By this point, by the time in February, we were also paying attention to the one that came out of South Africa and the one that was in Brazil. The effective treatments, the ivermectin was the treatment of choice if you were a dog with heartworms, but it doesn't work for COVID. I started tracking, I made estimates of when people would get their vaccines, share of the population. So 10, 20, 30, 40, and you can see we were pretty much on track the first time I ran that. In the third Lyceum talk, I thought it would be my final. That's a prediction I got very wrong. But you can see the vaccines were tracking pretty much right along the prediction. We had early problems and they kind of got ironed out. We caught up a bit. And we had the first real research project that wasn't the drug companies themselves. The Mayo Clinic reported on the effectiveness of the vaccine and confirmed that it was 95% effective. There was a big question about, even if you've had the vaccine, could you still be a carrier? Could you be a kind of typhoid Mary and it would just live in you and you could spread it even though you weren't sick yourself? And that's not true. It didn't turn out to be that way. But we got this awful picture of scowling Mary Mallon who spread typhoid that way. I predicted in March that the variants will be important, but they're going to be important in the long run and probably will require boosters. We're going to talk about that later, aren't we? But in the short run, everything we were doing at that point works. It was just go get your shot, go get your shot. Remember Yu Yang Gu? He was the best predictor and projector, and the guy just disappeared. I don't know what he's up to, but he was predicting we would be edging near herd immunity by the middle of the summer, and I bought into this. It's a combination of immunity from vaccination, which is this line, and immunity from illness recovery, and there's overlap because some of these people are getting immunized too. And I thought this was really a good prediction model and that we would be getting enough herd immunity by middle of the summer that this would be way low. I'll show you more. Anyway, this was my predictions, okay? I don't know, laugh, cry, whatever. I thought by the middle of the summer, since everybody who had been offered a vaccination, more of us would have taken it. And among people who were immunized, we could be mask-free and be extremely safe. And that indoor public spaces, we would not need masks. Well, all right. On to the next phase, which I'm calling the lull. This was from April to June, and we can see where the arrow is there. So this was my slides from May, the middle of May. Read aloud with me. If you have been fully vaccinated, the pandemic is largely over for you. You can now resume your activities without a mask. Who said that? Our governor. Middle of May. And Yogi Berra says predictions are hard, especially about the future. We were ahead on immunizations. It was a very optimistic time. It looked like we were actually going to get this done. And cases were falling faster than my own predictions. So there was a great deal of optimism during the lull. And I hit upon the idea of using the experience in Israel to predict what would happen in the United States. Israel used the Pfizer vaccine, and they were about 2 months ahead of us in immunizing their population. So this blue line is actually what happened. This is the number of cases per day on average, and Israel dropped from a high point to essentially nothing over about 80 days. Well, I predicted we would do something similar, except for we went up to begin with. But then we started getting the same slope of the curve, and we were dropping like a stone. So on this date here, I predicted that we would continue to fall, that we would follow Israel's projection. And I made that red line. I said, okay, I think that's what's going to happen. And that by the end of June, we would be down to just a tiny number of cases. You all know where this is going, right? I mean, I'll show you the follow-on to this, but that's what I believed in the middle of May. In the middle of May, also, we were becoming more and more aware of variants, and the CDC started tracking these. Notice this is from January, February, March, and now April. So at the end of April, this B.1.1.7 was taking over. This is the one from England, and we now call it Alpha. So alpha had begun with a small number, too small to even label at the first of the year, and had mostly taken over by the third week in April. And it was squeezing out all of these other variants. P1 is the Brazilian. I don't even remember what that one was. That looked to me like the variants were going to switch over. But the alpha our vaccines were working great against alpha. It just didn't seem to matter that much. So I predicted that they're going to be important, but since we were winning, it's not important right now. That eventually we're going to need booster shots. Okay, still, these are all slides from the middle of May, remember? And I predicted that we will have very few cases across the country. And I've been eating crow over that one for quite a while. Masks will become increasingly rare. No. Back to school vaccination drives will emphasize high school and college ages. That probably has happened. All right, we're done with the lull. Let's go on to the fourth wave, which is the phase that we're in right now. There you see, we're on this big slide. We're not as high as there, but we are at about 160,000 cases per day. And I talked about this on July 15th, just at the start. And this is when I continued the slide. We actually continued within my predictions until in July, and then we flattened out for a while, and then the Delta surge started. Okay, well, I didn't keep this graph up forever. This is the way it started. This is a New York Times graphic where they show the number of cases per 100,000 people, and where it's white, all of these counties where it's white, it's almost every state in the country had some. There were no coronavirus in that county at that time. But there was this blush of red and orange in southern Missouri and Arkansas, some down into Louisiana. We in Colorado had our own little thing going on in the West, and there was stuff starting down here in Florida. It was possible to ignore it in the middle of July, but it was started. Colorado had hot spots out to the west. Most of these are very sparsely populated. We had counties with no coronavirus at all, and Boulder was in the pale yellow, which was the best category, if other than none. And again, our vaccines were right on track by the middle of July. We had immunized almost 70% of Americans, and that was our goal by the 4th of July. We hit it some 2 weeks later, but we had done a pretty good job of vaccinating up to that point. And immunity, when you include immunity from illness recovery, about an estimated 70% of the population was immune. That should have been enough. By the early talk, 70% of the population being immune should have given us herd immunity, and the virus couldn't really take off. Wrong. So this was the slide then. There was this unpleasant little hook here at the end, but otherwise, compared to the third wave, we were doing really good. Something that should have been more of a warning was that the percentage of people going to the emergency rooms with COVID was starting to take off again. And this is a good indicator that things were going the wrong direction. That's a nice picture. I like that picture. All right, so still from 7/15. Remember, this was the alpha. And this little orange one here, which you can hardly see, but this slide was from the end of April. Now look at what you got. Delta was that little orange one, and it has jumped up, where Delta now by the middle of July was 52% of the cases in the United States. Delta was on the move. I'll show you where we are now, but I'll keep you in suspense. So I wanted to show the Delta started in India, and you'll recognize this curve as the Belgian curve, steeply accelerating up and then symmetrically falling down without any understanding of why. I mean, there was no sizable immunization program in India, and the India, at least I've never been there, but my sense of that society is it's jam-packed, and social distancing is impossible. And I would have thought it would have just kept going. There's no known reason why it dropped off, but it did. So we saw the Belgian curve in India. We noticed also that there was an inverse relationship between the percentage of people vaccinated. These are all states. You see this? And the most percentage vaccinated was Vermont, with about 2/3 of their people vaccinated. And at the other end, Mississippi has only 1/3 of its people vaccinated. And not surprisingly, when you graph the individual states, the number of infections averages out so that there's very low numbers for states that had very high levels of vaccinations. And these are the opposite extreme. So, all right, I believe this to be false. The New York Times said a discouraging trend fueled by the spread of the Delta variant and the sputtering vaccination campaign. I believe that to be false. I now believe it to be in large part true. I think Delta is more contagious, and the effect of that contagiousness has fueled in part this fourth wave. And of course, it didn't help that we all quit doing everything. We quit wearing masks. We went wherever we want. We did all the stuff that we'd like to do. Okay, so that's the end of that. And in fact, this is the end of the whole retrospective. And I want to get on with talking about that. So, but I'm going to stop the share, hoping you people will all wake up and any questions, any comments, any reminiscence of your own about that. You don't have to. You're not on the spot. Catherine, you usually ask the first one, though. Unmute yourself.
Question.
So where I think there's a pivot right now is how much do we tolerate the people who are not playing by the rules? I mean, that's my dilemma. So at when do we say, okay, we are going to stop accommodating people who are choosing not to be vaccinated, and we're going to insist that people be vaccinated to get into play. I want to go to plays. I want to go to concerts. I want to do the stuff. I played by the rules, but then that engenders a class conflict. Anyway, what do you think about that?
Well, I like that, but go on. Talk about. Catherine works at the University of North Carolina in the legal office. What is the University of North Carolina doing about mandates?
Well, we've been trapped in this dilemma of mandating vaccines or not mandating vaccines because we're held hostage to this political agenda. And so, we're waiting for our first home football game is this coming weekend. We had a lot of students go to Blacksburg last weekend, to where 66,000 kids were crammed into Virginia Tech's Coliseum. Duke, 13 miles down the road, is mandating vaccines and tightening the vice on all of that stuff. And we're not, because we're held hostage to this political agenda. I mean, it feels so complicated right now.
Right. And I am going to show I'm going to show the effect on the county level of vaccination versus cases and deaths. And what the vaccines work. It's really quite hopeful. And if we could get 65% is what it looks like. If we could get 65% of the people vaccinated, then this will die down. We're not going to get there nationally without some mandates. Now, the other thing is that what we're seeing right now in the Delta surge is a bunch of people are getting their immunity by illness recovery. And unfortunately, we're up to about 1,500 deaths. So I think you're absolutely right, Catherine. I'm going to be optimistic, but I'll keep you waiting until my.
Kurt, I want to get anybody else with a question. Susie Helburn, you had a question? Unmute yourself. Okay, if you have a question, unmute yourself and ask and be civilized. That's what we are.
All right, you don't have to have questions. I'm the one who's on the spot here. Any more? Let's go on.
Yeah, I have a question.
Okay,
Yeah, this is Arthur Nozick. There's a controversy out there regarding the immunity of people who have had COVID. New York Times said that those people have a higher level of resistance, and other reports say they have a lower level of resistance compared to the vaccine. What's your opinion about that?
yeah, my interpretation is that there's the balance of evidence is that they're similar. So the people who have recovered from illness probably have similar resistance to getting it again. And I think our country maybe made a mistake by not enrolling those people. So that if we go with, like Catherine would like, a mandate to go to a play, you have to be vaccinated. Well, it would be good for them to be able to have on their phone that they are also immune. What we also know, though, is that people who recovered from illness and then got the vaccination have a really nice jump in their immunity. So the most immune person in our society right now is the one who's been both vaccinated and recovered from the illness. And especially if the variant they recovered from is Delta, they've got an enviable amount of resistance.
Okay, thank you.
That's
I have a question.
That's
Yeah.
Susie Halburn. And
I heard there is another variant called the Mu
Yeah.
variant. What about it?
I love it. I'm going to talk about that.
Okay.
But building up anticipation, all you other people out there saying, there's another variant, new, what? Okay, well, let's get to that. Let me share screen here. And okay, that looks successful again. Come on. Okay, so I'm in the second section now. I want to talk about the current status of the epidemic, touching on Boulder as well as the United States. I've shown this slide till you're completely sick of it. But here is deaths. So you see here in the United States, we are at about 1,600 deaths, where we peaked at almost 3,500 in the third wave. And this is what I wanted to show out, that in the first wave, the number of deaths were completely disproportionate to the number of cases because we weren't testing. But the rest of this curve kind of echoes the number of cases. So that's important. You see, I showed before how the visits to the emergency departments across the country is a leading indicator. This is a really good sign. The fact that the percentage of visits in the emergency rooms is going down is a good sign that what we're seeing with the cases leveling off is probably in fact true. Here is the hotspots. This is average number of cases per 100,000 people, and it's color coded by county. So the darkest red burnt color is in fact the highest. And you just see this huge southeast creeping up into the lower Midwest. You see really a quite abrupt boundary when it gets up into the northeast part. And you see this stripe of clear space here too. We're going to have to watch, but I'm hoping it's reaching a barrier where it's not going to spread anymore. I'll show you more slides of why I think that may be true when we get down to making predictions. Remember, this is what it looked like. It started with this blush in Missouri and Arkansas, Louisiana, and a little bit in Florida. Here's an in-between slide when it was going nuts in the Gulf Coast states. And it started to spread into Kentucky, but Tennessee was mostly still free. And then this is where we are now. That's bad. It's bad, just plain bad. Boulder County average number of cases peaked a little before and has fallen. So we are now in a mask mandate because this was above the threshold. And we'll be in that mask mandate for 3 weeks, 3 weeks below the threshold. So we all got to hope that that just keeps going down. Deaths in Boulder County, we had this huge wave. The orange ones were people who died in nursing homes. We had during the lull, we got down to 0. And so now we've had 3 deaths in about the last month and a half. 2 of them nursing home folks and one other person. For Boulder County, the city of Boulder is this darkest part of the bar on the bottom. Longmont is equal approximately in the number of cases. And then we've got Superior and Lafayette, Louisville, and then the rest of the county. So you can see the 2/3 or so of the cases are made up of Boulder and Longmont. All right. Questions about our current view? I'm going to stop the share. We got convenient at that. Questions about any of that?
I have a question, Kurt.
Yeah.
I don't buy this India thing. It's very puzzling to have something peak and then drop, and we don't know why. That's important information.
Yeah, it is. And I have asked everybody I can think of, and it really looks as though the virus, if you took a closed community, say 1,000 people, some little town where nobody came and went, and you introduced the virus, it would go ripping through the susceptible population, and then it would taper off. But none of these places have closed populations, and the number of people who actually got sick is not enough to have predicted that the virus would slow. So it's a very curious thing, but we've seen it over and over and over and over again.
I have a question, Kurt.
Yeah.
It looks on your maps like we all really ought to take up stakes and move to Nebraska. Nebraska is almost completely white. Is that true?
No, Nebraska.
Is that just
Tom is laughing. Tom's from Nebraska.
Tom who?
Lincoln. But Nebraska quit reporting. I never got an understanding of why. But Nebraska is an unknown.
Okay.
So one thing, Kurt, I'm a little worried about your thinking things are going to go down right now because the schools are back in session, and of course the kids can't get vaccinated yet, and I have a sneaking suspicion that's going to ruin the early decrease in those curves.
And mark that, everybody, mark that, because I don't disagree with that. I'm going to go ahead and make predictions that I think are optimistic, and I'm going to show you some supporting evidence for that. But what Fred says is true, that we've got Labor Day surge, almost certainly all these parties that people just went to, and the kids going back to school. And those are 2 variables that are kind of getting thrown into the mix now. Absolutely right, Fred.
I have a question from Sam. How confident are we that other countries or regions are testing as thoroughly as the US and reporting as accurately or honestly as the US?
No, we know they're not. We know they're not. I think European countries, which has been the hottest of the hot spots besides us, report accurately, and I think we can trust Japan and South Korea and Australia and New Zealand. There's a whole range of countries we can non-European trust, but I think Indonesia is one of the hottest spots in the world right now. I have no idea if you can trust Indonesia's numbers. Stan Hunting had a question. Where'd you go, Stan?
Stan?
I'm here. So wouldn't the Belgian curve or the Indian curve be explained? This is only slightly facetious. If all the people involved in reporting and recording and testing all got sick and died?
I think that's the best explanation I've heard. You get 400 master points. Okay, let's go back. This is going to get too long. Share screen. We made this work. Share this. Share. There,
You're in.
I'm in. And so now we're going to talk about vaccines. Oh man, we're going to talk about variants. How come? No, oh, I know what the problem is. There we go. So I had shown this before where B.1.1.7 was alpha. And remember, this was towards the end of April. And then it progressed with Delta early in July. Delta had taken up more than half of the space. How many, think to yourself, what do you think the percentage of Delta is now? 99%. It's unbelievable. Delta's just taken over. There's nothing else but Delta here. We are going to talk about mu in a little bit, but this is the family tree. It's a simplified family tree, and it starts in December, and then time goes forward as you go down the page. So you can see that this is the alpha, for example, and it ruled. There was a lot of different alpha variants, but the alpha starts to drop away. There's no alpha all the way down here. When you look at the delta that's making it to the end of this, and most of the gamma is gone. So these various variants, delta is just out competing them worldwide. And you hardly see any variants that are making it to the current day. The next big thing is mu. Maybe, probably not, but maybe. It is another variant. It was first found in Columbia, South Carolina. The World Health Organization has labeled it a variant of interest. That is their low level of concern. If they elevate it to a level of concern, that will be a concern. I mean, that's right now, what the World Health Organization believes is it's one to follow, but not one that's going to be terrible. I mean, there will be one that's terrible, and maybe mu is it. But I think everybody's on hyper alert about mu. Thank you, folks who asked about that. Okay, questions about variants?
I got a question.
Yeah, all right.
I have had my third shot,
Good for
and
you.
I'm pretty careful. Where am I in safety?
In safety?
Yeah.
Let me not talk about you specifically, but a person in those circumstances, a person who is otherwise healthy and not taking any medications that would lower their immunity, but just old, but you've had the third shot, you're pretty dang safe. Now, if you have diseases or medications that lower your immunity, then that becomes a very variable thing. You'd have to talk to your doctor about. But I'm going to show you some experiences in Israel about the third shot in the next section when we talk about vaccines. Did I answer the question about mu? I can't remember who asked that. Any other questions about variants? I mean, Delta is the one to beat worldwide, and it's a nasty one. There'll be another one. Okay, I'm going to go back to the slide. Let's talk about vaccines. Okay. All right, here we go. Talking about vaccines now. This is the CDC's vaccination data sheet. And there's a lot of information on this. I'm not going to go through all of it, but this number is encouraging. 92.4% of people over 65 have had at least the first shot. And that's, you know, this makes up a large portion of the people who are dying from this. It kind of gets back to Catherine's question, or the question Art just had, is that if we could take the at-risk people and get all of us persuaded to take the vaccination and we're all safe, well, to some degree, you can just let things go. I want to point out a couple of other dots, though. First, 10% of the people who got the first shot haven't got the second one, and we know that's a mistake for our group. The other thing I want to point out is this number, the percent of the total population. This is the easiest number to track. And when you're trying to compare over time and over different countries, the number of people who are fully vaccinated and as a percentage of the total population. And this is probably the number that matters when you're adding up towards herd immunity. So that's what I want to talk about a little bit. And these slides, Mark sent me these slides today, and these hot off the press, they're really very good. It's using Johns Hopkins data. Nebraska doesn't participate, thank you very much. But what this is there's a circle for every county, and the small circles are for counties with very low populations, and the large circles, this is Miami-Dade, are for counties with very large populations. So you see there's so many counties in here, it all mushes together, but then they scatter out. So this is the percentage fully vaccinated. There's some little county out here that is vaccinated 85, 87% of its people. And then this one at the opposite extreme has vaccinated about 12% of its people. But you see this kind of swoop sense to the curve that the more highly vaccinated you are, the less the number of cases. So I want to show you, put a line on this right where the national average is. And you can see that people with less than the national average of vaccinations are tending to have lots more cases. If you're counties that are more than the national average, well, some of them still have large numbers of cases too, but more, you got this clump that's down here. Miami-Dade, it turns out, gives vaccinations at its airport. And Florida does not, in its cases numbers and its deaths, if you're not a Florida resident, it doesn't count you. But if you get vaccinated in Florida, it does count you. And so when you take out of the mix the Miami-Dade County people who got their shot at the airport, this moves back to here. So there is this really kind of encouraging line. I want to draw one more line, and this one I want to put at 60% vaccinated. Counties that achieve 60% vaccination of their total population have very low rates of infection. And this may be the marker. We're at about 53. We've got to get to 60. Now, the immunity from illness being substantially similar to immunity from vaccination would count too. And it may well be that states that had serious epidemics like Michigan will have, even though they are not yet at 60% vaccinated, they may have that level of immunity because they're average in terms of immunizations and they've had all of that. Let's look at the same graph with deaths, because I think in some ways it's even, to a degree, it's people dying that we care most about. And you can see this again, all of these counties up here that have large numbers of deaths and low numbers of vaccination. Let me add that this is the 60% line. So this to me is the goal. If we can get a 60% immunized, plus probably some immunity from recovered illness, the death rate goes way down. And I'm encouraged by that, and I'm incorporating that as a touch of optimism for this curve. Just a minute about vaccine hesitancy. You can see the blue bars are people that have been vaccinated, and the light blue are they have not yet, but they intend to. And then the salmon color stuff is vaccine hesitancy. And you can see the relationship we know. It's young people that don't get vaccinated. And I think mandates, I think all of that would be a good thing. I'm all in favor of it. Let me show you some about income. It is below poverty. The number of people who've actually gotten immunized is low, but there's less vaccine hesitancy. You've got a group of people who live below the poverty line who just can't get their act together to go. I don't quite get that. Well, I guess I do get that, but they're not hesitant about taking it. They say they're going to do it. They just don't get it done. And this may be a group that we really could work with somehow. Also noticed insured versus uninsured. You know, some of that may be the age, but insured people, the folks who have the kind of lifestyle with a job or with Medicare, Medicaid, are much more likely to be taking the vaccine than uninsured people. The racial stuff is less. For a while, Hispanics and Blacks were trailed way behind. These other categories, you know, this is American Indians and Alaska Natives, Asian people of Asian heritage they're all getting vaccinated. But if you look at Black people, Hispanics, and white people, well, Hispanics and white people are dang near equal by this point. The Hispanics have caught up. The Blacks population still lags behind. But this to me is less relevant than age and economic status at this point. That's a change. That's a change. Okay, let's talk about vaccine effectiveness in terms of breakthroughs. This is tricky to calculate. I'm not going to try and do it with all you guys, but you got to be careful that you don't include unvaccinated people in your equation before vaccines were available. So for example, if you said in 2020, 100% of the cases were in people who had not completed their vaccine. Well, of course, nobody had. So of course, 100% of the cases. And if you took Fraser, for example, where all of us have been vaccinated, then every single case is in a fully vaccinated person. So you have to be really careful of who you're talking about. And I screwed this up in an email not long ago. The CDC counts everybody. Well, that's clearly a mistake. They're counting everybody who died in 2020, and they're saying vaccinated people make up less than 1% of deaths. Well, that's just stupid. It doesn't give any information at all. The New York Times did it for this year. Well, okay, that's better. And I used their 2%, but it's still not very good because in the early days, there were lots of people dying who hadn't had a chance to be vaccinated yet. So the best comes out of Colorado. And our epidemiologist, Dr. Herlihy, I don't know this person, pointed out that the unvaccinated account for 80% of cases, 87% of hospitalizations, and 92% of deaths starting in July. So this is after everybody's had a chance to be vaccinated. Let me show you that numbers in the other way. Breakthrough cases amount to 20%. Breakthrough hospitalizations, 13%, and breakthrough deaths, 8%. Those are good numbers in Colorado right now. So I used to say when we talked about Pfizer vaccine, 95% isn't 100%. That was kind of my mantra for a while. Well, we can say we're protected. Art, this is back to your question. We can say we're protected, and that's true, but 8% of the deaths are still in breakthrough infections. Now, there's more of us who are, just to continue to complicate the math, there are more of us elderly who have been vaccinated. So we're more likely to die. Doing this really is very complicated, but I would rather have you say we are 92% protected against death than to say we're 98% protected. This is that Israel stuff I promised. So this is for people age 60 and older per 100,000 residents. Google Chrome translates this. It's a little, they're giving the third vaccination, they named the project, and Google translated that as impulse. So this blue, this dark green line is people who have had the booster shot already, and they use Pfizer only. This light green line are people who had 2 shots, and the blue line is people who are didn't even have 2 shots. And you can see the number of deaths over here per day. So the number of deaths among people who have gotten the booster shot is almost 0. It is not completely 0, but it is almost 0. And it is distinctly better than the people who only got 2 shots. And this is, I think, the best evidence in the world right now that we should be taking a booster shot. Congratulations, Art. You're the first little green dot down here. Okay, one of the ways the booster shot may be working in the short run is it boosts IgA. Too complicated to go into, but we have different kinds of antibodies. IgG is the main one that's in our blood, and it can last a long time. IgA is the antibody that's in your nose. So when you get a booster shot, it produces both IgA and IgG. And so at least for 80 days, where on average the IgA lasts, you're fighting the coronavirus in your nose without waiting for it to get to your bloodstream. And that may be a big advantage in the short run. Rick sent me this. Of course, you can't see this, but this is the current childhood immunization graph. And the oldest one out here was the DPT, the diphtheria, tetanus, whooping cough. And you notice that we give that 5 times to every normal child. So there's a certain sense in which we're somehow expected 2 shots to be enough. That was probably never true. And expecting a booster shot, expecting that 3rd, 4th, maybe 5th shot is probably really what we should be expecting. They're working out the timing of that. But if they say 8 months is what we're going to stick to, then I come up sometime in October and I'm going to take the 3rd shot. Okay. Oh, and then both Pfizer and Moderna have developed shots specific to Delta. And somehow we're not using those. The FDA said the current stuff is working just fine, thank you. So, okay, enough. Let me stop this again. Questions about vaccines, and then I'm going to go into predictions. How late are we? Oh boy, okay, I've used my hour.
Doing okay. Arthur, you got a question?
Yeah, I had a question about
Arthur, can you back off your mic just a bit, please?
I had a question about the Belgian curve. Is it the same for deaths and cases?
Yes. They're offset a little bit. The deaths lag the cases, but yes, it is.
So it has the same shape,
Yeah.
whether it's deaths or cases. And what?
I'm going to bore you to death in a minute about Belgian curves. I'm going to try and make predictions based on the Belgian curves, even though I think Fred may be right that I'm way out on a limb. But was there a follow-up on that, Arthur?
Yeah, and what about the variant? Is there data showing the nature of that Belgian curve as a function of variance?
The original Belgian curve, which happened November of 2020, was pre-Delta, and the Indian curve was almost all Delta. So we have very similar shaped curves for those 2 examples.
Okay, thank you.
Thank you.
Joe, you got to unmute yourself. Oh, there you go.
Yes, a while back you were talking about 20% and then 13% breakthrough. Is that 13% of the 20% or 13% of the whole?
A good question. I got to state this more clearly. It's if you take all of the people who died during that time period, 8% of them were unvaccinated, were not completely vaccinated, and 92% of them were not completely vaccinated. So it's of the number of deaths. And likewise, breakthrough hospitalizations was 13% of the hospitalizations that happened during that time of the period were people who were fully vaccinated. Did I answer your question, Joe?
Any other questions? Okay, Drew.
One more.
Yep, Stan?
So I think you touched on this in one of your emails recently, but the count of breakthrough cases, that includes people who show up in the hospital from a car wreck and are tested positive for COVID just before they die, right?
Yes. Yes. I
And
think,
is that significant?
no, I don't think that's significant, but I think where it is significant is when you not in counting deaths, I don't think that's significant, but in counting cases, there's evidence now that we have situations where we're doing widespread testing, like a whole sports team. University of Michigan Medical School, they tested every medical student. Well, they found 20 positives. None of those kids were sick. And so in terms of cases, I think routine testing programs are finding virus in noses of people that are not sick. And in fact, really sort of raise the question of, well, what's an infection? You know, if you've got it in your nose, but it never invades and never makes you sick, you're not infectious. Are you a case? Are you infected? Well, we found the virus. And I dealt with that a little bit in my email today, but I didn't include a slide on that. That in fact, very low amounts of the virus in your nose can be detected and not cause an infection enough for your body to develop antibodies. But that's kind of a weird circumstance. If we got to the point where we're testing huge numbers of people twice a week, it's going to skew our numbers some. Okay, grand finale, folks. I want to get rid of this. All right, let's do some predictions. You know, I want to preface this with an acknowledgement that I completely failed to see Delta coming. This fourth surge, I was during the lull was very optimistic. I thought we had reached herd immunity and life was going to go back towards normal. I don't know anybody else who saw it. There probably were people more pessimistic than I, but making predictions based on other countries is problematic. It's the best I know how to do, so I'm going to go ahead and do it. But let's acknowledge the weakness in the methodology. This is when I was trying to do it with the Israeli experience, and now this shows the extension of that surge up until I got depressed with that graph and quit doing it. So I'm just going to try. Remember the Belgian curve back in November? It isn't just two countries. I've seen this. This is present all kinds of states. I've seen this 30 times, 50 times. And so now this is in India with the Delta. And I identified with the help of my engineer nephew, 3 points on the curve. This is called an inflection point. Up until that point, the number of cases per day is accelerating. And now it decelerates, it slows. And where you switch from acceleration to deceleration, you could call that inflection point. And that happened on August 11th. We know our own for that. And then you can mark the peak. And so by telling the interval between these two, if we follow this curve, we're going to see this very gratifying rapid decline in the number of cases. And we can pick this day too. So let me apply that to what we've had. We are, this was August 11th was the inflection point. And now I think we are at the peak right now. We don't have good numbers over the holiday weekend, so I can't be sure, But this is a graph that only shows 12 weeks rather than the whole case. And you can see how we rose and plateau. We had a little bump here, and we just seem to be at the peak. I put the arrow 2 days over because we're going to get some more data, but I think we are in fact at the peak. And I think it's going to start down. So how long is it going to take to get down? This is India, of course, again. My prediction is it will be the end of October when this curve bends over and comes down. We won't be all the way down, but that's at the, I'll go back up and show that. I call the end of the surge where the slope here is to 45 degrees. So, oops. So I think the end of October. So my most basic prediction is there's a tremendous amount of hand wringing right now. That's very important because things are completely out of whack. But I think as we progress through September and into October, the optimism is going to return. It's going to be working. We're going to say, yes, that is in fact coming down. So I have, I don't want to overstate, but I think the questions of herd immunity, I showed you those slides before where if we can get the vaccination rate to 65% plus immunity from recovered illness, I believe that is in fact gonna put us over the top. The key to watch is whether the Delta surge stops at states with high immunization rates and states that had a major outbreak. Yes. So this is what I was talking about before. What we need to watch over this next couple of weeks is whether this red keeps spreading on into Michigan, where Michigan had a terrible epidemic and has large amounts of illness recovery immunity, or whether it progresses into the Northeast where they've got very high immunization rates. Hopefully Colorado, we had a pretty good epidemic of our own. Hopefully we're protected by illness recovery. And in Boulder, we have very high immunization rates. We're over 70% in Boulder. So, okay, here's really predictions. I think the cases per day are peaking right now and that they're going to decline over the next 6 to 8 weeks. I think deaths and hospitalizations will be disproportionately among the unvaccinated, that booster shots are on the way, that people right now are in effect choosing whether they wish to get vaccinated or get sick. And bad information is out there. It's out there in droves, and it's going to continue to drive much of the decision making. Mandates, I think, I hope our country, but this of course is going to be political. There's going to be states that will have mandates and states that don't have mandates. But I think we're seeing the terrible surge in the states that are not willing to do these things. So I believe that the mRNA vaccines, the Pfizer and the Moderna, will be customized not for this variant, but for the next one. And I do believe we'll be immunizing children later this fall. I had predicted that for September, but I haven't heard a peep out of anybody. So probably September's optimistic. Long term, we're going to see more and more variants, whether Mu is the one that's to worry about or whether it'll be the next one. Booster shots, we'll probably get them as an annual event for the elderly. And there will be surges, although I hope there is never another surge in the United States as bad as this fourth wave. Enough. I'm done.
Gail Adair has a question before we sign out.
Yeah.
Gail? Yeah, unmute yourself.
Since you decided that it wasn't necessary earlier to wipe everything down,
Yes.
are you wiping things down because the Delta is more transmissible?
No, good question. No, I think there's just a ton of evidence now that this is airborne. It is other person's breath. That person has it and they breathe in your face, either in droplets or in fine aerosols. So what matters is what you breathe. And so ventilation of the room, wearing masks, being outdoors, those things matter. there's no evidence at all that using Lysol on your kitchen countertop makes any difference at all.
Yay.
I got a question from Sam, and probably that's the last one. Is there a point, do we start caring less about the number of cases and more about serious cases, hospitalization and deaths? Are we at the point where we have to learn to live with COVID? And Kurt, you'll never get off the hook on these presentations. I added that.
Let me rephrase the question to be sure I've understood it. Is there going to be a point where we quit worrying about how many cases there are, and as long as deaths and hospitalizations are low, we're going to go back about our lives? Is that a restating of the question?
Sam?
Okay, so I mean, yes, I think we're sort of there now. Not completely, because here we are at Fraser putting our mask back on, but both because the largest proportion of people who are getting sick, even those who are dying, are choosing not to be vaccinated. Well, there's a kind of, I believe in some kind of freedom and choice. If you have the freedom to be stupid about this. But you're going to take a risk and you're going to die, and I feel bad about that, but I don't feel terrible about that. And I think that's now I feel terrible if we haven't done everything we can to get good information and availability to people. So targeting people in poverty, that's probably a biggie. We've done a better job with other ethnic groups. We got to keep trying to get the vaccine out there. But after that, when this surge is over, I think much of society is going to quit worrying about going out again.
So guys,
Joe?
have a great evening. Thank you, Kurt.
What,
As always.
one more question, comment?
Oh,
I just wondered, is really the steady state, you might say, that we're hoping for, what might be called a pandemic, or I'm sorry, endemic?
Yeah. Well, yeah.
I mean, that it's not going to go away.
That's correct. It'll never go to zero. But the phrase, maybe not everybody knows this word endemic, is just the diseases we take for granted. They're around all the time. And that's colds and flu, and they just circulate through the society. And we care enough to take a flu shot, but we don't wear masks and we don't alter our behavior. Although maybe in the future we all should wear masks with the flu. I am hopeful that there will never be a surge in the United States as big as this fourth wave has been. But we will see other waves. There will be a fifth wave, there will be a sixth wave, but those waves will be progressively smaller. I think getting kids immunized is a big step in that direction.
thanks, Stephanie. I got 3 more questions here. Arthur Nozick, Fred, and Dale.
Okay, this kind of relates to your optimism a few minutes ago. So if you're in an optimistic region and you predict a somewhat optimistic future, if there are pockets of high infection, won't this be the opportunity for the virus to undergo variants and become even more contagious than the Delta variant, so that it's these localized populations that refuse to get vaccinated that will be continuing to be a great danger and could produce waves even worse than what we're experiencing now or in the past.
I think that states the pessimistic side very well. I wouldn't limit it just to pockets in the United States. It's worldwide.
Right.
You've got Indonesia going nuts. Well, those people get on airplanes and come here. And we've pretty well shown that nasty variants are going to spread around the world. So I think the battleground will shift, though, from being, it's going to go back to being a pharmacologic battleground where Pfizer and Moderna and anybody else who can get into the act will be producing vaccines specific to these new variants, and then we'll be taking boosters for those. I think that's maybe next year. but I think that's a coming phase.
Fred?
Okay, my question has to do with the Indian curve comes up, comes back down very quickly. Question is this just a natural thing that's happening because of the virus and no intervention by the people? Or did India actually do something to try to correct this? They saw that this was coming up and they made some changes in lifestyle, et cetera, that actually allowed this thing to go down. So is it a natural thing of the virus, or is it a combination of effects of the virus and a society of people understanding what's going on and making corrective actions in behavior?
And maybe both. Those aren't mutually exclusive.
No,
And in Belgium, when we first saw it, I thought, okay, maybe they just locked down super tight and there was no more contagion. But seeing it over and over again, seeing it different states, seeing it different countries.
yeah, but it still could be multiple effects, and it could be people recognizing that something new has happened and they've corrected action based on this, or it could be just the virus itself in a closed.
And I think there's something about the virus. I think there's something about the virus. I mean, my sense of Belgian society is that they might have taken radical enough action to have shut the thing down. That's not my image of Indian society.
I don't know. That's why I asked the question. I don't know the data, but I suspect it has something.
No, there's no data, and
there's
no intelligent discussion of this in the scientific literature.
I've got one last question from Dale, and then I'm going to do an executive privilege.
Dale, how are you?
Dale?
So, yeah, so the graph looks like we're at a peak or approaching a peak, but at the same time, students are going back to school. We're approaching colder weather when people are going to be indoors more, and there's lots more human contact. And I'm just wondering if, what your feeling is about that.
All true. I tried to put disclaimers on my prediction before I put them out. I think what you're saying is absolutely right. I mean, with schools, with Labor Day, with this cultural divide we've got going on in this country, all of those things would have the effect of widening the curve, so that rather than abruptly up and abruptly down, it maybe arches over and wiggles its way down. And I think that may, I think we are at the peak. I think the fourth wave is running into boundaries that are real, and the deep South states are already going down. Florida's already getting better. Louisiana, Missouri, Arkansas, Mississippi, all of those states are having declines in their cases. So if it isn't successful in spreading to these other places, we're going to see it to go down. But as you say, if these other influences that might increase spread to the degree they rule the day, then we'll see a slower decline on the backside. One more? Anybody else? Are we done?
There's a big good night here and a big thank you. Karen, you keep it short. Karen, you're muted, but.
I do have a question. It seems to me that we're kind of just taking for granted all of these inoculations. Is there any concern about people over 80 who may be sensitive and have a problem with all? And I am 1,000% in favor of myself receiving now the third booster, and I'm concerned and would ask if you have any impression of the fact that there could be any danger to our systems at over 80 years old being able to accommodate all of these. And then there's talk about a special vaccine, another one after the booster for the variants. I'd like your opinion about that. Thank you.
Karen, I think we do need, when they start giving the vaccine, the booster, it will be mostly to elderly and at-risk people. And they need to track the side effects. We can't take for granted that the side effects with the third shot will be identical to the side effects with the second shot. But the small sample that have had that already, it is similar. The other thing is your immunity, your natural immunity is reacting to things every day. Every time you get a virus of any kind, a cold, whatever's coming along, your natural immunity is reacting to that. So the fact that we give your body one more thing to react to is really inconsequential in the big picture. Your body's already reacting to hundreds and even thousands of things. So the last I would say to that is I don't know of a single person in the hospital from a vaccine reaction.
Okay.
I don't know, nationwide maybe, but you think how many hundreds of thousands of people are sick and hospitalized and dying from the virus. Whatever risk you got from the vaccine is pretty dang small.
Okay. Thank you.
Thank you, good people. We'll see when the curve reaches the bottom.
Then I'd like you to become obsolete, but I don't think it's going to happen for a while. Be well, everybody.
Bye-bye.